welcome to the 82nd show of Ask the Governor. Governor John Bel Edwards has been with us for 82 consecutive months, and as usual, in studio with us is Jerry Mayer from Hometown Productions. So if you're watching, you can thank Jerry Mayer for making it possible to see this show in places all across Louisiana. And of course, we're on about 20 stations which have carried this program largely from the start, starting in April of 2016. But as mentioned, the governor celebrated his 7th year in office just a few days ago, the anniversary of him taking the oath, and in his first day, he expanded Medicaid, something that I think 14 governors in the United States still have not done, but in Louisiana, because of the preponderance of poor people we have, the Affordable Care Act enabled many of them to get coverage they would not ordinarily get. And I would think, Governor, based on what you have said in previous programs, you view that as a major accomplishment in your tenure in office.
I do, and I thank you for bringing that up. By the way, Happy New Year to everybody. I haven't spoken to you since last year. The Medicaid expansion was critically important for our state because it helped us simultaneously address the historic budget deficit that I inherited that was slightly over $2 billion. And also expand health care coverage to working poor people. And as you will recall, we had one of the nation's highest rates of uninsured working age adults in the country, and it was hovering around 24%. That number is much closer to 9%, right at the national average now. And as a result, people had access to care, which means they had a primary care physician. They could get diagnosed with whatever medical conditions and diseases sooner and start their treatment and get their prescription medicines. And it has mental health benefits, both inpatient and outpatient, substance abuse, inpatient and outpatient. And the reimbursement for the providers is so much better than if the individuals remain uninsured. And by the way, uninsured individuals, to a large extent, are relegated to an emergency room, which is the most costly, least effective way to try to manage disease. For all of those reasons and so many more, it was the right thing to do, and hundreds of thousands of Louisianans are presently enrolled in Medicaid expansion. They're benefiting. We haven't had a single rural hospital close in Louisiana, and largely because of the Medicaid expansion, which drives reimbursement for the services they provide. And quite frankly, they've been closing in states that haven't expanded Medicaid, primarily in the South. And I do think we're down to 11 states now. Not all because the governor signed it. There were some states in conservative states where they were able to get it on the ballot. And I don't know that there's been a single ballot initiative in any state for Medicaid expansion that has failed.
Well, the reason, and it was one given by your predecessor, was that it would break the bank. In this case, we're talking the federal bank, because what the state even now is about 10%. Is that what the cost is?
Yeah, well, you're capped out at 10%. So 90% of the cost is borne by the federal government, and no more than 10% by the state. But I want you to compare and contrast that 10%. If an individual remains uninsured, when they go to the hospital and get care, you owe about 40 cents on the dollar from the state, and the feds are going to put up 60%. But you can insure them through the Medicaid expansion for no more than 10%. And the providers largely have taxed themselves to come up with the 10% because their bottom line is still much better, because they're getting additional reimbursement above and beyond that they would otherwise get, even after they look at the assessment. So it has cost the average taxpayer next to nothing, but at the same time, we have driven economic development because we have more people who are able to be hired and so forth. And then the last point, there's a lot of points I can make. The last one I really want to make is we had no idea 7 years ago that we had a pandemic coming. But COVID-19 preys especially upon those people with comorbid health conditions. And the sicker you are, the more likely you to be hospitalized, have a severe case of COVID-19, and potentially die. And so having an opportunity to get people healthier saved lives. There's no doubt in my mind that the Medicaid expansion saved lives. And that's true even without COVID, because people get screened for cancer and they get treated for cancer, whereas otherwise they would have just gotten sick one day, gone to the hospital, and realized that cancer had progressed much further than needed to be the case. And so, not perfect. We still got work to do, but it's a really good deal for the state of Louisiana.
Is it more than 500,000 people? in our state?
It is. It is currently, and it gets a little tricky because during the public health emergency with COVID, the state got an enhanced FMAP, which means the enhanced percentage of the program that the federal government pays, but also we couldn't disenroll anyone. But starting in the next couple of months, we will be redetermining eligibility for everybody on the rolls, and people who are no longer qualified won't stay on the rolls. By the way, it is very important for Medicaid folks out there to make sure that LDH has their contact information so that we can determine their continuing eligibility, their phone number, their cell phone number, email address, physical address. We got to make sure we can contact these people.
We're inside 9 months now from the next governor's election. I think it's 38 weeks from Saturday, October 14th primary. And some of the gubernatorial candidates, and there are 5 announced now, and 4 of them are Republicans. I think 2 of them have announced they would keep Medicaid expansion, including Sharon Hewitt, who, as you know, is an extremely conservative senator. But a couple of them haven't said one way or the other. Is that a major issue in the campaign as you see it?
Well, I don't think it will turn out to be a major issue because I assume the ones who haven't spoken about it don't know enough to have an opinion yet. But if they when they learn more about Medicaid expansion, the benefits to the people of our state. By the way, these are working poor people. The poorest of the poor have always had Medicaid. These were working poor whose employment benefits didn't cover health care, and they didn't make enough to be able to afford it, and so they were left out. And by the way, it's a pro-life position to offer people health care, right? So I can't imagine that any serious candidate for governor would have a position that they wanted to end the Medicaid expansion. And I'll note that there's not a single state that has expanded Medicaid that has reversed that decision anywhere.
This is true, but there are still, 11 in the waiting zone because...
And go look at their rural hospitals.
The 82nd episode, and Governor John Bel Edwards is at your service as he is once a month, and as far as we know, he's the only governor in the country doing this. The last one was Chris Christie, and he's been out of office for a little while in the great state of New Jersey. Sarah in New Orleans. Sarah, you are on Ask the Governor.
Hi there. Thank you. Yes, this is a little bit off the topic that you started with, but I am representing someone who got a recommendation of clemency in 2020, about 3 years ago. And I know that there are a lot of recommendations from the pardon board that are sitting on your desk. I'm wondering if you have a time frame, because I get asked this question all the time, a time frame for addressing them or a method for addressing them, and whether you're going to be able to address them all before you leave office.
Well, first of all, Sarah, thank you very much for the call. And this is part of my responsibilities that I take very seriously. And I can't remember, I think you said 2020, when this recommendation came to me. And so I don't know the individual that you're talking about, but I am quite certain that I have reviewed the file at least once. And if you haven't heard about it, then that means I didn't sign it, but I also didn't reject it either, and so it remains pending. I have, unlike my immediate predecessor at least, and more in line with some previous governors, I have signed a number of commutations and pardons and other clemencies that have come to my desk with the recommendation from the pardon board. It's a part of the process that I really believe in, but I will tell you that some of the very most difficult decisions that I have to make as well. So I'm quite certain that I have looked at the particular file that you are referring to, but I can't tell you that with certainty because I don't know the individual's name. And the last part of the question had to do with clemency petitions that come to me with a recommendation. By the way, if they're not recommended by the pardon board, I don't get them because, as you know, the Constitution only allows me to say yes or no to a clemency application that comes with a favorable recommendation from the pardon board. So anyone that comes to my office from the pardon board before I leave, I will look at them. Doesn't mean that I'm going to sign them, because that's it's not automatic, and it certainly isn't automatic with me. But I will give them very serious consideration.
877-217-5757 for Governor John Bell Edwards. Let's go to David in Atlanta. David, you're on Ask the Governor. Hi, David.
Good afternoon, gentlemen. And Governor, that was a great thing you did with the Medicaid expansion. Governor, many people in Louisiana have not been vaccinated and boosted for the virus. And I'd like to point out, there was a recent article in the Washington Post. There's right-wing propaganda being dispensed on talk radio that the vaccine is causing people to have strokes. Well, a study that was published found virtually no cases of that. It's probably non-existent based on a scientific study. But in the Far East, 60,000 people have recently died from the virus. As many as 500 million people in China can contract it. That will likely spread to this country, and many of these virus strains could mutate. And Louisiana is grossly under-vaccinated. It could be a catastrophe, and with Mardi Gras coming up, it could be an event that would spread this. I think there needs to be an emergency state program to educate people and urge people to get boosted and vaccinated.
All right.
David, thank you very much for the call. The 60,000 number you came up with, that's in the first month since China lifted its lockdown. And that number comes from the Chinese government, which most experts believe is probably underreported, and that the number is much higher. I don't have to go to China. I can tell you that as of today, I received a number of 18,479 Louisianans have died of COVID. And the fact that people continue to die needlessly is very sad. And it's largely those 65 and older with comorbid health conditions. And quite frankly, they're either unvaccinated or they're unboosted. And we continue to educate people. There's programming right now. If you listen to the radio, if you watch TV, if you all sorts of avenues out there where people are told about the importance of remaining current with respect to vaccinations. And the vaccinations were never designed and never represented as preventing someone from contracting the disease. They're designed to prevent a serious illness that requires hospitalization or death. And in that regard, they work very, very well. And so we actually are doing relatively well in Louisiana at the moment. The worst period in the state's history with COVID, over the pandemic, I should say, was this time last year. And we're nowhere near that. We've got about 483 people in the hospital. The percent positivity on the reported test is back down to 12% from 18% 2 weeks ago. But you're right. More people need to be vaccinated, and quite frankly, the folks who are out there, the anti-vaxxers who will just pursue any, rabbit hole that they find, it really is sad. And I think it's directly responsible for a number of people choosing not to be vaccinated or not to remain current with their vaccinations, and that is very sad.
How many shots have you received, Governor?
Ooh, I've actually lost track.
5? 4 or 5?
I think I'm up to 5.
5 shots.
Yeah, I think I'm at 5, and I when Joe Cantor tells me I'm due, I go get a shot. So I don't hesitate.
Have you had side effects?
No. Actually, the only side effect I have had is a little soreness at the injection site. I've actually wondered whether the vaccine was working because it didn't produce a robust immune response. But I've been assured by Joe Cantor and others that absolutely it worked. And I did actually have COVID for the first time this past June or July, and had a very, very mild case, which I attribute to the fact that I was vaccinated and boosted and up to date.
877-217-5757 for Governor John Bell Edwards, number 56 in the honor roll of Louisiana governors. And a year from now, he will be into private practice and living the life in Tangipahoa Parish. And we've talked about that, but and you say you probably will at some point get involved in the governor's election, but do you feel like you're leaving the state in a better position than you found it?
Oh, absolutely. And look, not that we are without challenges, and not that we've made all the progress in every area that I would have liked. But in so many ways, we just talked about the Medicaid expansion. There was a $2 billion budget deficit the day that I walked in to office. We have corrected that. And in the current year, there's an excess of $928 million that was recognized by the REC last month. Next year, there's an increase in general fund revenue of $608 million. And we know there was surplus that exceeded $700 million from last year. And this is extremely important because if you're going to stabilize and then increase your investments in critical priorities like education, early childhood, and higher ed, so forth, you got to have the revenue to do it. Otherwise, you're just talking. But we've actually done it. We're making record investments in education now. And then, quite frankly, we know that in several years, the 0.45 additional sales tax is going to roll off. That's $800 million. And so by having surpluses and excess, we're going to be able to withstand that fall off in revenue. But in the meantime, the extra revenue is incredibly important because all of this federal money for infrastructure with the infrastructure bill, it requires non-federal match. And if they increase the amount of money they're willing to give you, you have to have more money with which to meet your match obligations.
Gotcha.
And to go back, by the way, and put towards projects that come in over the estimate because of inflation, which basically all of them are. So it's the right thing to do in terms of the way that we've been budgeting, and we've not put a single one-time dollar against a recurring expenditure. There were $800 million like that in the budget that I inherited. So am I leaving the state better off? First of all, I'm not leaving the state. I got a year left, and I will eventually leave the governor's office. And at that time, yes, I believe that fundamentally and in many, many respects, Louisiana would be better off than the day that I walked into office.
Rebel in Baton Rouge. Rebel, you're on Ask the Governor.
Jim, and Governor, thank you so much, and thank you again for your service. And I do hope that one day you decide to run for office again, hopefully on a national level, because we sure could use you. My question is about Louisiana's congressional districts and the gerrymandering thereof. And I know there's lawsuits and things in the pipeline, and I'm wondering exactly where that stands and what else can be done to rectify it. Thank you.
Well, thank you very much, Rebel. So let me just remind all the listeners. The state of Louisiana is just very slightly less than 1/3 African American. It's like 32%. We've got 6 congressional districts. I believe that 1/3 of them should be black majority districts if they can be drawn in a way that makes sense. And not only can they be drawn, we know because the legislature considered one that actually had 2 majority black districts. And the black majority district that would have been based in Monroe was actually more compact than the white majority district that they left in place. It satisfies the redistricting principles better than the current map that keeps 5 majority white districts. And so to the extent that there's gerrymandering, it is in the present map. It's not in the one that was rejected. This matter is now before the U.S. Supreme Court. They took a case out of Alabama first. Our case is a little bit different, but many of the principles are the same. I actually think there's a more compelling legal argument in favor of the second majority black district in Louisiana and adopting a map that was rejected by the legislature than there is in the Alabama case. But quite frankly, it's an open question the degree to which this Supreme Court remains committed to the Voting Rights Act. And that we should all get the answer over the coming months, and we will see. But it remains my hope that Louisiana will have 2 majority black congressional districts. I just think it's fair and it's right, and you end up with a more compact 5th district than the one that we currently have.
And as we know right now, with the slight majority the Republican Party has in the U.S. House of Representatives, every seat is precious.
Well, no, that's obviously true. But when the map was rejected, when this plan was rejected by the Louisiana legislature a year ago, every expectation was that this was going to be a blowout election in favor of the Republicans. And so, but in any event, right is right. And I just believe that fairness and decency and the law, the Voting Rights Act, as it is written and it has been applied up to now at least, require that we adopt that second majority black district.
Were you watching the Kevin McCarthy? I would call it a coronation, but it was far from that. He had to fight to get that job as Speaker of the House.
No, he did, and yeah, I was watching. I mean, not 100% of the time, but I would tune in often enough to try to figure out whether it had been resolved.
For the 68th time, James in Longview, Texas has called in. He holds the record for Ask the Governor callers, and good afternoon to you, James in Longview, Texas. James, you're on the air.
Good afternoon, Jim, and Happy New Year, Governor. Anyhow, I was reading in the news where the state of Louisiana is deliberating on how to use the budget surplus, and it cited one thing that needs to be paid is the $300 million that's still owed to the federal government for hurricane protection programs that the feds have provided around New Orleans. My question is, do you think any general money should go to revitalizing the old French Quarter to kind of boost it?
Yeah, well, thank you very much, James. You're a very faithful listener and regular caller, and you are always current in terms of what's the news of the day. So, with respect to surplus, you and the other listeners should know that the Constitution requires that the surplus from last fiscal year, which appears to be about $728 million, 25% to the rainy day fund, 10% for the unfunded accrued liability in our pension systems. And then the remainder can be used to pay down debt, to do capital construction, and to satisfy non-federal match obligations. And so the $300 million payment that remains, it's a little more than $300 on the hurricane storm damage risk reduction system in the greater New Orleans area, is something that could be paid from the surplus. However, the WRDA bill that was attached to the December appropriation bill in Congress actually gave us 10 years to make that last payment, because each of the last 2 years we made $400 million payments. So we've already paid paid $800 million toward that balance. And so we're not going to pay that $300 million this year because we have an opportunity under that same WRDA bill to work with the Corps of Engineers and satisfy our obligations to the federal government with credits because of our money we have spent on coastal restoration and protection projects that benefit the storm damage and risk reduction system. So we're not going to be paying that amount. We think we'll satisfy it with credits, and that's money that we can use for match obligations with the infrastructure dollars coming down. And also, and this really is going to be the first draw on the one-time money, all of the infrastructure projects that we have in place now that we've already spent some money on, they're coming in above the estimates because of inflation. So if we want to just complete the body of work that we've already committed to, we're going to have to go back and plus up those projects with funding, and that'll be the first draw. And there'll still be considerable funding opportunities left, but we will be heavy on infrastructure with those one-time dollars. And just like last year, when we had over $300 million of recurring revenue that went to one-time expenditures, I expect that you're likely to see that happen again this year to some degree. I'm not sure of the amount, but we will be presenting our budget to the legislature on February the 17th.
877-217-5757. Lou in Baton Rouge. Lou, you're on the air with Governor Edwards. Hi, Lou.
Hi, how are you?
Doing fine, Lou. Thank you.
Hi, I'm a scientist. I was at LSU before I retired, and I was very concerned about the virus when I first heard about it. And I could see that it started in Louisiana during Mardi Gras, and the New Orleans area had the virus at a very high level, comparable even to New York City. And I tracked it, and I have been tracking through all this time for over 3 years now. I've been tracking the amount of virus, number of deaths in Orleans Parish, Jefferson Parish, and Baton Rouge, because they're the three biggest, most populated parishes in Louisiana. And I figured that I could see how the virus was moving towards Baton Rouge to protect myself. And I also heard that the federal government is part of the group that plans the New Orleans Mardi Gras, but they never mentioned to the people in New Orleans that they ought to take precautions against the virus. So I'm just wondering if you're aware of this, and also what future protections one might expect from the state to make sure that the virus doesn't again spread from New Orleans throughout Louisiana.
Well, Lou, thank you for calling in, and certainly you're right. When the virus really got a foothold here in Louisiana in March 2020, it was for a number of reasons, but principally because we had just had one of the biggest Mardi Gras we had ever had in terms of the number of visitors from other states and from around the world. Unbeknownst to us, they were coming in, some of them, with COVID, spreading it around, and many more people left. But it got seeded pretty deeply and widely in Louisiana to the point where for the second half of March of 2020 and early into April, we had the highest case growth rates being measured anywhere in the world by Johns Hopkins. And I am acutely aware of the challenges that presented. At this point, it is hard for me to believe that there are a lot of people out there who don't know the importance of protecting themselves, being vaccinated, being boosted, staying current there, but knowing that if by virtue of your age or comorbid health condition or both, you're more vulnerable, you really need to protect yourself. And that means that you either don't go in certain densely populated places, especially indoors, or if you do, you protect yourself by wearing a mask. And so all of these precautions remain the same that we've been talking about now for going on 3 years. And I expect that there will be a fairly robust crowd for Mardi Gras in New Orleans this year. I expect it to be a safe event from a public safety perspective, both as it relates to COVID and otherwise. But it's just hard for me to believe that there are people out there who don't know the basic things to do to protect themselves. And then we need to protect those vulnerable members of our family and our community. If we know it, we need to be doing things that will protect them as well.
877-217-5757 is your number. There is a line open for Governor John Bel Edwards. We go to Covington. Lisa, you are on the air with the governor.
Hi. Yes, good afternoon, Governor. It's nice to talk with you, and thank you for all your efforts on our behalf. I'm calling today because I feel that libraries are for everyone, and I'm aware of a campaign to undermine our libraries with book banning by certain political groups, and seems possibly perpetrated by the Attorney General, who has a tip line where we can report our librarians for, I guess, pornography, which they, on the other side, they admit is not in our libraries. But there's 150 books here that have been challenged. LGBTQ books featuring people of color, books on sex education, and they're being put to the side because there's so much pressure on the board. And we've read that the Citizens of New Louisiana is targeting all 64 parishes to remake the libraries in their image. Lafayette, Livingston, Rapides, and Bossier Parish and St. Tammany are currently involved in this struggle. And I wanted to see if you wanted to weigh in.
Lisa, thank you very much for calling. History is replete with periods when there were book bans and book burning. Not a single one of them has history looked kindly upon. And I think that will remain the case with the current effort. And if you listen to what they're attempting to ban, for the most part, they're attempting to ban things that don't exist in our libraries. But in order to sell a false narrative, they have to vilify people, and that comes down to librarians. If someone doesn't want to go to the library, they don't have to go. If they go and a book doesn't interest them, they don't have to check it out. They don't have to read it. But when you start trying to control unreasonably the information to which other people have access that they may be interested in. I really think that's a problem, and I hope that the majority of people in Louisiana would see it the same way. And I have no doubt that this is a political calculation by the Attorney General. He believes it serves him well, not so much in his job as Attorney General, but because of the job that he seeks. And it's my hope that he has made a fundamental miscalculation on that.
The person you're mentioning, Jeff Landry, is supported by his party, and the chair of the party is doing everything he can to keep other Republicans from running against him. What do you make of that, if anything?
Yeah, I don't weigh into whatever's going on internally in the Republican Party. I just pop the popcorn and enjoy it.
And on a tragic note, the former head of the Democratic Party received a 22-month sentence last week for offenses committed during her tenure as chair of the party. Your thoughts on that?
Yeah, and I accept what she said to me personally, what she said publicly, and that is she suffers from an addiction to gambling, and it really caused her life to be in turmoil, and she made some really bad decisions for which she is taking responsibility, and I wish her well.
Now, last time on this show, I think we talked with you about Insurance Commissioner Jim Donelon opining that a special session might be necessary to address insurance issues that some are terming a crisis. And you indicated at that point that you thought it might not be necessary. Has anything changed in the last month to alter your point of view?
Well, the commissioner is making the case that we ought to appropriate funds to support the incentive program that the legislature basically resurrected in 2022, and I signed it into law, to really try to depopulate the Citizens Plan from some of its policies. And in order to make that happen, the incentive program needs to be up and running so that new companies can access those grant dollars in time to purchase reinsurance, which is before hurricane season starts. And so it's a question of timing. And I can tell you that I'm having conversations with the Senate President and the House Speaker. We do believe that money needs to be appropriated into the fund. The only question is whether we do a special session to do that or whether we do it in the regular session that starts in April. And I know that there are still some questions about the timing issue, not the necessity of it. And there's some legislative leadership that will be meeting again and questioning Commissioner Donelon. I don't think there's opposition to doing it. It's just a question of when we do it. And it is entirely possible that we would have a special session. And if we do, the special session would probably come very early in February, which only leaves us several more days to make that basic determination. But I don't want to have a special session if it's not necessary. And so we just have a little more due diligence that we have to undertake.
Jeff in Metairie. Jeff, you're on the air with Governor Edwards. Hello.
Hi, Governor. How are you? Thank you for being such a moderate steward of our law and politics. I think you're a good man. You've done some good things for the state of Louisiana. I'm in the business of insurance, and I will just tell you, Louisiana Citizens was granted, a 66% increase in, raising their policies this year. And it's to cover cost, obviously, because it's very expensive to go through a storm these days. So, you hit those topics. I mean, I would certainly agree with, a special session because people are hurting right now. They've been hurting for a while. These rates are outrageous. You got a couple surplus lines markets that are still in the area. A couple carriers that are still alive are non-renewing like crazy. The depopulation that we've seen from Louisiana Citizens is sort of in and out. Guys will agree, then they'll come back the next day and say they're not participating today. And so the cost is real. We have a lot. I work in the city of New Orleans, so we have a lot of single people on fixed income that cannot afford, the $3,000 and $4,000 increases in insurance that they're getting. And, that turns into $8,000 if it's $4,000, because you've now got $4,000 in deficit in your escrow and a $4,000 shortage to pay your bill for the next year. So it is unsustainable.
Jeff, I absolutely agree, and there is a crisis. And one of the things that was explicitly mentioned in the legislation last year that basically recreated, with some slight modifications, the incentive program that was created after and in response to Hurricane Katrina. But it mentions a crisis. It talks about Citizens, which is supposed to be an insurer of last resort, but obviously way too many policies there. And by law has to charge a premium 10% above what the market would charge. Otherwise, it's not an insurer of last resort. And as you know, when things get out of control with Citizens, assessments get made against every homeowner's policy in the state, not just against the Citizens policies. And so it's not a question of whether we are going to put funds into the incentive program. The question is whether we're going to go into special session and do it, or whether we do it early in the regular session that starts in April. In either case, I would expect the money to come from current year excess. And because it's current year excess, a supplemental appropriation bill for the current fiscal year is in order. And what we need to know is that if we need to go in now in order to allow companies to take advantage of the incentive money and purchase reinsurance ahead of the hurricane season so that they can get in and take over some of those Citizens policies, that's what we want to know. And quite frankly, there is a difference of opinion emerging as to whether we need to go in, because and if we do go into a special session, that it will actually have the desired effect. But it's not a question of whether we're going to do it. It's a question of whether we do it in a special session in February or whether we do it when we go in April. And I'm in regular consultations. In fact, had a meeting today with legislative leadership, and we haven't made a final decision yet.
Tony in New Orleans. Tony, you're on the air with Governor John Bel Edwards.
Hi, Governor. Thank you for providing the forum for citizens to be able to call in and address you and ask you questions. I just want to ask about, support for public radio. I'm a big supporter of public radio, and, your thoughts on the benefits and value of public radio, and also, why you made the decision to have this forum here on public radio rather than on commercial radio.
All right. Well, there are some commercial stations carrying it. You just happen to be listening to a public radio station, and a very good one, WWNO in New Orleans, our biggest affiliate on this network of stations. And Governor, I presume you're an advocate of public broadcasting.
Well, I am, and I will tell you, I don't get as many opportunities to listen to the radio now as I used to. I used to, when I was driving my own vehicle, listening to the radio with the XM radio. I would always have public radio stations. I just think you get the most in-depth coverage. It's not going to be a talking point or a headline. You're going to get really in-depth coverage that include analysis and interviews and firsthand information. And then you're going to get purely educational and interesting things too. And I'll be honest with you, I think the reason that we went with the Louisiana Radio Network is because there's nobody in Louisiana who commands the audience that you do, Jim, and this network of radios, stations across the state. And we wanted to be able to tap into that. And I think our judgment has been validated because this is the 82nd show. Mm-hmm. And I know that people listen because I go all over the state of Louisiana and I talk to people and they tell me they are regular listeners. Mm-hmm. And I'm always somewhat surprised when people do that. So I do believe in public broadcasting, TV and radio. In fact, we had LPB at the Governor's Mansion last night because we had a fundraiser for the Governor's Mansion Preservation Foundation, but also for Adonna's Louisiana First Foundation, and we had Amanda Shaw there, and she performed with her fiddle, and she was excellent. And LPB was there, and they're going to air that on February the 23rd at 7 p.m. And so I just believe in public broadcasting, TV and radio.
As far as media as a whole, many in public life don't care for people who cover them or the things they write or report. Do you think you've been treated fairly?
Yeah, but with exceptions. The rule has been fairness, and I really believe that. And not that every day I can read the paper and find something to disagree with. I don't think it's intentional. I don't think it's malicious. Now, there is a bias towards the sensational sometimes, and so forth. But having said all that, I really do believe that overall, I and my administration have been treated fairly. Mm-hmm. That is the rule. There are a couple of exceptions out there.
But in your line of work as a politician, and a pretty good one, you've never lost a race. Negative campaigning works. As much as we hate it, and I don't think politicians really like it, they use it because the data shows that it works.
Well, I think it works, but also, it's kind of like any other skirmish that you get into. You may be determined not to do something, but the very first time it happens to you, that rule kind of goes out the window, right? And so
punch,
but having said that, there's a way to campaign and there's a way to govern. And I do hope that whether people agree or disagree with me, like me, dislike me, whatever, I have tried very hard to be measured and balanced in the way that I govern and the way that I talk about other people and about policies and so forth. I've tried to be very measured, and I've made a calculation that they don't want to see in Baton Rouge what they see in Washington, and I think that has borne out.
The governor will return next month. We thank you for listening and participating today. Hope you have a great rest of January and early February, and there will be much to catch up on when we revisit you next month. Until then, stay safe and stay tuned.